Okay. And good evening, and welcome once again to the Your Health is Important Facebook Live broadcast. I am Dr. MJ Collier, your host, producer, and on-air personality, and we are so glad that you have decided to join us this evening. As you know, we like to know who you are and where you're from. So when you start to upload, give us your name, where you're from. I want to hear from all my regulars, but also if there are any new people, if this is your first time, make note of that. Say first time listener, first time tuning in to the Your Health is Important broadcast. Remember, all the information that you're looking for and all the supplements that we refer to are available at the website lipodrops.com. Lipodrops.com. You can go to the website and find out what's going on and what we need to know. So thank you so very much for joining us once again. First thing, let's go to my weight loss update. I'm down only additional 2 pounds. I was hoping to knock out the last 10 pounds and be able to celebrate, but I tell you, that final 10 pounds is really hard to do. I'm glad to see that I'm still progressing, but I'm approaching somewhat of a plateau. But remember that my original goal was 20 pounds, and then I got to 30 pounds, and then I decided, okay, I'm going to try 10 more, and that would be it. And so that's why it's so difficult. My BMI is so low now, and my body fat has decreased so substantially that muscle mass is being challenged. And so I want to try to maintain muscle mass. So I'm doing more aerobic exercise. I mean, basic things that I don't have to go to the gym to do, like the old school exercise you do in PE, jumping jacks, jumping rope, push-ups, sit-ups, those sorts of things. They help tremendously maintaining a good muscle tone. So we're trying to do that, but that has definitely slowed the weight loss down from the dramatic weight loss that we had originally. But I'm still happy again versus gaining any. And I have started to expand my diet. As a matter of fact, yesterday I had dinner that was steak and lobster. So that was great, and I thoroughly enjoyed that. And so no problems here, but I still was feeling kind of full today. And so what I've taken in today, nothing for breakfast and one half of a sandwich for lunch. And that was it. And still feeling full as we speak. Not sure whether I'm going to have dinner today or not, but we're still working on it. Remember, I'm using the Lipodrops Maximum Strength Formula. I put a dropper full under my tongue before each meal, about 15 minutes before. I hold it under my tongue for 2 minutes, then swallow it. Then before my 2 largest meals, which are either breakfast or lunch and dinner, I take one of the Keto Max tablets, which puts my body in the ketotic state, ketosis, the basics of the Atkins diet and the South Beach diet. And, now it's just being referred to as a keto diet. But I take one of these before either breakfast or lunch, and then the second one before dinner. Then for routine maintenance and health, I take the Doctor's D. That's the 5,000 International Unit vitamin D product that boosts your immune system. And then we have the omega-3 fish oil, which is good for cardiovascular health. And then probiotics. Probiotics I take. You can take these 2 at night or 1 in the morning, 1 in the evening. And so recently I've been taking 2 at night, mostly because I've forgotten to take the 1 in the morning. And no problems with that, but that gives you GI and immune health. And because we're seeing so many weird things happening with this coronavirus now, we are having people that are having recurrent infections 2 weeks after they got diagnosed. Stephen Collier, the nighttime talk show host, had just gotten over it, had opened back up his studio and was filming live, and then was re-diagnosed with it 2 weeks later. And this case has happened more than once for people taking the Pfizer COVID pill called Paxlovid. The Paxlovid cases, they've shown people are getting recurrent disease. And so they are oftentimes getting, of course, the Omicron variant, of which there are 2 subvariants now, the B2 and the B1.2, 1.2, etc. So these are things we have to be concerned about. So I'm taking my Lipo Immune. Now, this is a product that we created specifically to boost your immune system. It's got 3 things in 1 pill. So instead of having to take 3 separate pills, this has zinc, it has B12, and it's got it's got liposomal vitamin C. It's got zinc, and it's got elderberry extract. So those 3 things are very good for boosting your immune system. And this is also available on our website, the Lipo Immune product. And you take 2 of these capsules per day to boost your immune system and give you an opportunity to fight off viral infections such as influenza and the coronavirus, bacterial infections such as strep throat and pneumonia, fungal infections such as nail fungus and vaginal yeast, jock itch for men. These are things that your body will simply not allow to grow in your and set up home, basically. And so you won't get those fungoid nails that really become deformed, and it takes 6 months or more to totally normalize, or you have to have them surgically excised. So that's why we are with that. And we're going to talk about, and I'm going to continue on a topic that I had this morning on the Ricky Smiley Morning Show when I did my broadcast. We talked about STDs. And let me tell you, STDs have become a major problem because for the past 2 years, really, we have really optimized our health. We've been talking about washing our hands and doing all the things we have to do. But this has not been the issue. We have not been protecting ourselves from STDs. And the only real protection that you can take versus catching the disease and then trying to treat it would be condom use. That's male and female condoms are literally the barrier method. They're the only method that will protect you from STDs. But you have to understand, if your sexual activity includes oral sex and you're not using a dental barrier called the dental dam, you can use condoms all you like, but then as soon as you have oral sex, you've exposed yourself to the same bacteria and or viruses. So for the CDC just updated their information about STD rates, and the increase in the United States has been as 23 million cases reported by the CDC. It's 23 million cases. Syphilis cases have nearly doubled, and everybody thinks syphilis is something that's old and it's not there. The amount of neonatal syphilis, in other words, babies that are born with syphilis, has increased by 37%. Gonorrhea has increased by 67%. 67%. And last but not least, chlamydia is at record highs. And oftentimes when a person has an STD infection with chlamydia, they also have the gonorrhea. So gonorrhea and chlamydia infections are usually a dual infection. They happen quite regularly, and it's something you have to protect yourself from. So if you're not in a monogamous relationship where you have sex with only one person and you are 100% sure that person is only having sex with you, then you need to protect yourself with condom use and no exchange of body fluids. And that is specifically indicated with oral sex so that you can protect yourself. Safe sex is barrier methods. There's no spermicides. There's nothing you can insert. There's nothing you can paint on. There's nothing that you can do to protect yourself from catching the STD. That is why all other forms of birth control will say this does not protect you from contracting sexually transmitted diseases. And that's not even mentioning the incidence of herpes infections and HIV, which is markedly increased, particularly after plateauing and going down, the rates are increasing. And that is in females from age 15 to 24, and in men that have sex with men or gay men. So and that doesn't matter whether you're a top or a bottom, your incidence of HIV has increased. So that's where we are now. Let's get this party started. This is your show. You tell me. CL Turner, good afternoon from Baton Rouge, Louisiana. Thank you so much, CL. We appreciate you. Felicia in North Carolina. Thank you, Felicia, for tuning in as well. Ray in Chicago. Chicago, first time. Thank you, Ray. We really appreciate you. I don't recall having a Chicago person. Lisa Moore, good evening from Albany, Georgia. Albany is in the house. That's south from Detroit. So now we got south. Now we got north. We got Midwest with Chicago. Viewing from Michigan, Carolyn Brown. Thank you so much, Carolyn. We appreciate you. Chicky Williams, listening from Fremont, California. West Coast is in the house. So now we got West Coast, East Coast. Lanita Rose from Arkansas. Anybody from Florida, New Jersey, New York. Thank you, Lanita, for tuning in. We appreciate you. Okay, Billy Sue, Billy Sue, it is so good to see you. And you have the first question of the day. Does IBS cause upper stomach pain? IBS can cause pain anywhere in your GI tract because the GI tract is one long space. The first space is your mouth, then your esophagus, then your stomach, then your small intestines, then your large intestines, then your colon, sigmoid colon, and rectum, all one space. Once you start having spasms, because there should be a rhythmic contraction starting from your mouth all the way down that moves food continuously from up to down until it's digested and you eliminate the byproducts as species. So if that rhythm is disrupted at any point, you can get lack of forward movement, or peristalsis is what that's called. No peristalsis, so the food just sits there, and as the food sits there, it's at 98.6 degrees. It starts to ferment. It starts to become even more foul. And then you can either get reverse peristalsis, which makes you have nausea and vomiting. So you can get a pain in your upper stomach, lower stomach, anywhere along that track with irritable bowel syndrome. But understand, irritable bowel syndrome is just really a description of the symptoms. There's no disease state called irritable bowel syndrome. That's just, it's kind of a diagnosis of exclusion. We can't find out anything else. Your stomach is acting up, so we're going to call it irritable bowel syndrome. The key point is that you treat a lot of these symptoms the same way, so it doesn't matter what name you give it. So, if it's excess acid, you give either H2 blockers or drugs like Pepsid. Pepsid AC, or you give other acid reducers such as Nexium, omeprazole, etc. So those are things antispasmodics. And then you want to take something that will keep your colon empty, because a backed up colon aggravates all of these issues. So great question, Billy Sue. Thank you so much. Sharon Williams, can you give some information on lipoedema? I think lymphedema is what you're saying. That's swelling of the, it can be upper body as well as lower body. Upper body is most commonly associated with the surgical procedure where you remove the lymph nodes. In the good old days when they would do mastectomies on women, they would also remove the lymph nodes, and that would interrupt lymph flow, and they would always have a big swollen arm that they had to keep wrapped up, and difficulty using it. It becomes heavy, becomes weaker, etc. You can have lymphedema of the lower extremities that can be as high as the buttock. The lymph flow is where fluids come out of your capillaries as blood moves down from the large arteries down to the capillaries. There's only space for red blood cells, and so all the fluid that it's floating in comes out of the blood vessels, and it floats under the skin in what's called a lymphatic system. The lymphatic system returns it back to your circulation when it's functioning normally. But if for whatever reason this system of plumbing or tubes or pipes or whatever you want to call it, it's in your body, it's supposed to move that fluid will collect. Now you may notice if you sit down for an extended period of time, if you have a job at a computer and you're sitting at your desk for extended periods of time, that fluid will build up, mostly because of gravity, because the action of actually walking will strip that fluid from your legs and move it back toward the center of your body, where you either urinate it out or it gets back into your circulation. So you have to move. If you're sitting down, you need to get up at least every 2 hours, take a few laps around your desk or in your workplace. You don't have to go outside, but you need to move. And even when you're sitting, you can just rock your feet up to the balls of your feet, down to your heels. That action that closes your calf off will help move fluid from your legs. So no real treatment other than compression therapy. There are some physical therapy locations that specialize in lymphedema, and they really can do a great job in moving that fluid, but it's a continuous process and problem. You have to stay on top of it. You have to stay hydrated. You also have to take diuretics. So it's a complicated balance of keeping the fluids in your body at a functional status without you resorbing fluids. You have to monitor your salt intake as well. So great question, Sharon. Okay. How long do you have to wait to get vaccinated if you tested positive and had mild symptoms? Haven't been tested since January 9th. You can get vaccinated at any time. At first, they were saying you needed to wait 3 months. Then they were saying 2 months. And then they were saying almost immediately. So if you have had the disease state recuperated from it after testing positive, I tell my patients you can go get vaccinated almost immediately. But anytime after 4 to 6 weeks is a definitive period that you will benefit mostly. Remember this: if you've not had any vaccine, you need to start getting your vaccines now. If you have had 2 doses of either the vaccine, by CDC definition, you are fully vaccinated. The recommendation, however, is that you get at least 1 booster of the Pfizer or the Moderna. If you got any vaccine other than the Moderna, then I recommend that your booster be the Moderna. It is the most effective vaccine that is available now, and it's one that I recommend that you get. If you have also had the disease state, recuperated from it, you have natural immunity, and if you have got 2 of any shots, 2 shots of either of the vaccines, then you are at pretty much optimal immune status and you don't need to get a booster. Doctors have been saying this, but the recommendations are not consistent with the scientific knowledge, is that you have that immunity. Now, in countries other than the United States, they're recognizing natural immunity as an immune status versus saying you have to be immunized. But in the U.S., If you've had the disease, you had COVID, been diagnosed, had a positive test, recuperated from it, you have a normally functioning immune system. This is for regular people, as I say. If you have immune system challenges by autoimmune diseases, you're on chemotherapy, other things that take you out of that group. We're talking about people that don't have those issues. If you are a regular person, you've gotten it out and you've recuperated from it, you've gotten 2 shots of Pfizer, 2 shots of Moderna, or 1 shot of the Johnson & Johnson, preferably 2 shots, but 1 shot, then you at pretty much optimal immune status. The only thing you can do at that point, you cannot improve your antibody status, but you can improve your immune status with products like our Lipoimmune. So go to the website, lipodrops.com, get your bottle of the Lipoimmune. It's got 3 things in it. It's got vitamin C. It's got the elderberry extract, and it's got zinc. Zinc, very effective in boosting your immune system and making the environment of your body unfavorable for bacteria pathogens to live. That's bacteria, viruses, and fungi, all those things. So the Lipodrops Lipoimmune product is one that I highly recommend to boost your immune system function. Next question. I just purchased the Total Mango Pack. Is it okay to take with Primrose Oil capsules? Yes, it is. Any product that's in the Lipo line, if you purchase it, it is compatible with virtually any other supplement, any other medication that you could be on, any disease state. You can have a list of high blood pressure, diabetes, high cholesterol, all these things. You can take the Lipo product line. You can be on various medications. They are just supplements. They're not going to interfere with any medication that you have been prescribed. They're not going to interfere with any other supplements, but you can add them to it. And Primrose Oil capsules are a very good addition to the Mango Pack. So we expect great things from you, Stella. We want you to keep us informed as to how your weight loss is going, and we want to hear from you. So great note. We want to hear from you. Thank you. Okay, Lanita, I'm 55, had a partial hysterectomy at 40, uterus removed. I was told I don't need pap smears anymore, and I will not go through menopause. At 55, I've had no signs of menopause. Well, that's good. Because you only had your uterus removed. Menopause requires you to have your ovaries removed, and that is why when you have a total hysterectomy, that includes the ovaries and the tubes, that's instant menopause. And so a lot of people have side effects from that, and they have immediate change in lifestyle, decreased libido, dry vagina, decreased interest in sex, all of those things. So it's very important that you have hormone replacement therapy. So at age 55, you just may not have reached the age yet to have no signs of menopause. We are proud of you, but it will get you at some point. You've just been lucky so far. You know, there's such a thing as your chronologic age. You're 55 on the calendar, but you may be 40 physiologically, which means your body is young, youthful, and it's going to be a while before you get it. One of the best indicators is at what age your mother went through menopause, and what age your aunts, what age your sisters. If you have older sisters, that's a good indicator. But the bottom line is the diagnosis of menopause is not having had a period for 1 year. If you don't have a uterus, you don't have a menstrual cycle. So that indicator is not going to be the answer for you. There's a blood test that can determine that as well, measuring your total estradiol and what's called your follicle stimulating hormone. Those lab tests can answer the question as well, but they can be abnormal and you still have not reached a menopausal state. But you don't have to wait to that. Since you're not having any symptoms, you don't need to do anything. But if you are meeting this criteria for some of the other listeners and you're having symptoms of menopause, you need to get bioidentical hormone replacement therapy. It will be life-changing. It will take 20 years off the calendar as far as how your body functions, how you feel about life, how you look. It makes your vagina thick. It makes your vagina tight. It makes your vagina moist. It helps with skin. It helps with hair, so you don't get hair loss. Your edges don't recede. All of these things are great benefit. More importantly, your attitude. You're the alpha female. You just feel great. You feel the way you used to do back in the day, and you're just enjoying life, and that's where you want to be. And the same thing for men. For men, increases your testosterone level, increases your muscle mass, decreases your body fat, gives you more energy, takes away that end of day tiredness and depression where you got big plans for the night at lunchtime, but you go home and eat dinner and you fall into sleep in front of the TV. You can't even finish the game because you're nodding by 8 o'clock. All of your energy and zeal for life has been taken. Bioidentical hormone replacement therapy will change all of that. And that is something you can Google, BHRT, or come to my office and get it. I literally have had patients fly in from California, Colorado, Florida, to come and get that type of therapy. But it's not difficult to find now. It used to be, but now it is readily available. If you Google BHRT providers near me, you can find out what's going on. But again, the 3 things that Dr. Collier recommends to optimize your lifestyle and the way you feel and the way you look: vitamin D at 5,000 international units per day, omega-3 fish oil, and probiotics. Dr. Collier's trio for good life and good health. Those are the things you need to go. You'll see those on the website. Go to the website, lipodrops.com, for more information. Next question, Hailey. Okay, Riley, does Lipodrops may affect scar tissue as well as fat? Stay safe. No, there's no fat. It affects your body's metabolism of fat, so it won't alter scar tissue. But as your skin shrinks, because there's no fat layer under it, it may shrink scar tissue, or it may make the scar tissue more prominent. It just kind of depends on where it is and the status of the scar. Some people have very small scars. Some people have what are called hypertrophic scars, or even keloids. So those things are variable. But the answer to your question, it does not affect scar tissue. It just makes you lose the fat. But losing the underlying fat tissue, if the fat is pushing the scar and making it more prominent, then it will be less prominent. So great question, Riley. Okay, Sean, big time, one of the regulars. Man, I'm so glad to hear from you. Thank you so much for tuning in, Sean. I don't think you've missed an episode, and that's good. And now you always have good questions. So here we go. Good evening from Monroe, Louisiana. My doctor said I was pre-diabetic and gave me Synjardy to take to my next appointment. Is Synjardy good? Synjardy is a great product. Synjardy consists of Jardiance, which is a SGLT2 inhibitor, which makes your body urinate out extra sugar. So not only do you urinate out the sugar, you urinate out the calories associated with that sugar, which is why it makes you lose weight, because you're losing those calories. So with Synjardy, it's a combination product, and doing so, it also has a DDP4 inhibitor in it that helps you metabolize sugar as well. So it's great. It's one of the best products. So your doctor's really on top of it, and to use it aggressively for pre-diabetes is good, because pre-diabetes means basically you don't have diabetes. You could get diabetes, but anybody who's not diabetic is technically pre-diabetic. So it's not a term that I like a lot because it has no clinical significance. It's just a term that became in vogue. But I like to say it's like being a little bit pregnant. Either you are or you're not. Either you're diabetic or you're not. But being pre-diabetic means that you might have a propensity, particularly if your family members are diabetic, your parents, your siblings, then you know that you're made of the same genetic material and you're predisposed to diabetes. So your doctor is taking a proactive stance. The Synjardy is going to be a great product for you. And the great thing about it is glucose dependent, which means when your sugar is normal, it doesn't do anything. It cuts itself off automatically. That is literally the most outstanding product. It is a smart bomb for this disease state is concerned. So great job. Keep taking it. You shouldn't have any side effects from it. It cannot make your sugar go too low. It only stops your sugar from rising. And when your sugar does rise, it clears the sugar out of your body. So it will help with some of the long-term sequelae of diabetes, like blindness, microvascular complications, macrovascular complications, heart attacks and strokes, all of those things. The Synjardy is a great choice for that. So great question, Sean. Big time green. Marilyn Pope Johnson. I had my gallbladder removed and I get constipated. What can I take? Well, I would start off with a stool softener such as Collier, and then if necessary, you can go to a stimulant type laxative. But you would be good. I would take something particularly with no gallbladder, like Metamucil or Fibercon. Those types of products will bind, some of the fat in your body and do that. Most of the time, people that have had their gallbladder removed have diarrhea as an issue, particularly if you eat fatty foods, because the fat is colloidal. It has a colloidal response, and if the gallbladder is not there to give you bile, which is primary function is digestion of fat, is highly acidic. It breaks fat down. If that fat cannot be broken down, then it absorbs, it causes you to absorb water in the lining of your intestines, and it just gives you that uncontrollable explosive diarrhea. So you can't go to the Golden Corral and eat at the buffet when you've had your gallbladder removed. You won't make it through the meal before you have to run to the toilet. But for the constipation, I would make sure, one, you're drinking enough water. Two, making sure you a fiber product like Miralax, would be good. Miralax, Fibercon, Metamucil, all those things would be good. But make sure that that's a problem. Constipation is usually not a side effect of having your gallbladder removed. So you may have constipation for other reasons. And make sure that you're eating crunchy fruits and vegetables. Crunchy fruits and vegetables. If it crunches when you bite it, it's good because it's high in fiber. It's good for your bowel function. Make sure when you get the urge to have a bowel movement that you go and use the toilet. You cannot hold it until you're in the comfort of your own home. This is a big problem with women and why women are so constipated, because they don't want to use the bathroom outside of their own home. And so when you hold the stool inside your colon, you lose the urge in about 30 minutes or so. It's not going to come back until you eat again. In the meantime, the large intestine is performing its primary function, which is the reabsorption of fluid. So the stool gets drier and harder, more difficult to pass if you don't get it out of there. Sometimes you have to break the dam down, taking a harsh stimulant laxative like a milk of magnesia or even mag citrate, which is what they use to clean you out for colonoscopy. Then you start on the fiber so you can maintain normal bowel function. Great question, Marilyn. We appreciate you. Tayana Davis, I purchased Dr. D probiotics and 2 other pills from you recently. Can I take a multiple vitamin with them, or is that too much at once? Not too much at all. None of the products that you mentioned are complete multiple vitamins. If you've listened to Dr. Collier previously, one of the things that I recommend for routine health is a complete multiple vitamin with iron and minerals. Now, the complete multiple vitamin, not just multiple, because a multiple vitamin just means more than one. It could just have B6, B12 in it, and that's multiple. So you want to have a complete, that is the verbiage that the label needs to state, a complete multiple vitamin with iron and minerals. That is the best product you can take as far as supplements are concerned for routine health, because there are no vitamins in the foods that we eat today. There just aren't any. And so we need to supplement what we're eating with that type of product. The name brands will be Centrum, Zbec, 1 a day for men, 1 a day for women. All of those are good, but there's no such entity as a generic vitamin. A vitamin is a fixed chemical formula. There's no better way to make it. So don't pay a lot of money for a fancy label, a pretty bottle, or a celebrity endorsement for a vitamin. Get the least expensive one that you can find. It'll say on the bottle, compare to Centrum, compare to Zbec, compare to 1 a day. And that's just as good. You ought to be able to get 100 vitamins for under $10. And the key thing about vitamins, you must actually take them. Everybody's got a bottle of vitamins that's sitting at their home right now, or in their medicine cabinet, or under their medicine cabinet, that hasn't even been opened. Or they open it, they take one, and they haven't taken another for 6 months. So you have to make taking your vitamins a routine part of your health. And so keep your vitamins by your toothbrush. You wake up in the morning, wash your face, brush your teeth, take the pill. With a full glass of water, it won't bother your stomach. It won't irritate your stomach if you melt the tablet that efficiently. And then it's gone. It's out of the way. It's no problem. You've taken care of your vitamin dosage for that day. You can do the same thing at night. I oftentimes will take vitamins and supplements at night before I go to bed. I brush my teeth. I take one before I brush my teeth, take another one. And that's usually like my probiotics and sometimes my vitamin D in doing so. But that, it's just a routine you have to establish to make sure that taking the supplements are a routine part of your day. Next question. LaWanda Prather. Hey, LaWanda, it's good to see you, hear from you as well. Can a pulmonologist find out why I have a nagging cough? Yes, a pulmonologist can. So can an ear, nose, and throat specialist. But I would start off with my primary care doctor, either your family physician or your internist, your internal medicine specialist, to find out if sometimes it's something simple. One of the number 1 prescription medications for blood pressure, called lisinopril, its side effect is that it causes a dry cough. So, you need to do an assessment of the medicines that you're taking, if you're taking any, simple things. It could be just simple postnasal drip from allergies, and you take a nasal spray and a decongestant, and that stops the cough. If you have a smoking history, then you want to get a chest x-ray to see if anything else is going on. But I would start off simply with a primary care doctor, because this coughing is not a big problem. After that, if you have not gotten successfully diagnosed and treated, they can call it one thing or another. They can say you have, the so-and-so cough or whooping cough or whatever cough you like. But if they're not treating it to the point that it's cured or at least controlled, then you need another more specialty diagnosis. Now where an ENT, sometimes a gastroenterologist, coughs are sometimes caused by gastroesophageal reflux disease, and so you take an antacid that stops the cough. Pulmonologist. So either of those specialists, but I would start off my primary care so I can be pointed in the right direction. It'll save you a lot of time wasted getting a lot of very expensive testing when it may be something as simple as you need to stop taking lisinopril. So great question, Lawanda. We appreciate you. Okay, keto diet pills good for your health. Yes, there's no downside to doing them. They are just putting you in a natural state of ketosis by giving you ketones. So you can take those. You can continue to do so. They will give you a pseudo-ketotic state so that you will lose weight just as if you were on the South Beach, the Atkins, or the keto diet proper. The benefit is you don't get the ketosis where you have very foul breath, underarms, and groin. We call that keto crotch. You do not, there's never a good time under any circumstances to smell like rotten fish. And that is what the state of ketosis does. It's very effective for weight loss, but it is not socially acceptable. And so one of the things that we did to benefit that was to come up with the Keto Max product, which has ketones products in it, and it gives you a pseudo state of ketosis and helps you metabolize fat and lose weight. Next question. Okay, Carolyn Keys, the best sunscreen to use. Great question, Carolyn. It is now, the sun is out. People were going out. One, any sunscreens you use versus no sunscreen. But understand this, SPF 15 is the best level of protection. The higher the number is on your sunscreen as you go, and some of them are 50, some of them are 55, etc. That only means you can be in the sun longer. They do not offer a greater level of protection than an SPF 15 sunscreen product. So the key thing about sunscreen is we oftentimes will go out, get in the sun, lay in the sun, then have somebody next to us put some sunscreen lotion on me. That is way too late at that point. You need to put your sunscreen on before you leave your room, before you go outside. When you're, as part of your morning routine, if you know you're going out into the sun, if you're on vacation, etc., put your sunscreen on then before you even get dressed, because areas that people get burned are at strap lines and bony prominences that they have not remembered to put sunscreen on. So your elbows and your shoulders, your cheekbones, the tip of your nose, all very susceptible to burning. So make sure that you put sunscreen on the eyes. If you put it above your forehead, remember it's going to come down into your eyes. So oftentimes a hat will shield this portion and up, and then you can put on sunglasses. But then from here down, you need sunscreen. Make sure you get your ears. Ear burns are a big problem, and of course the back of the neck. We will oftentimes do the whole front of the body, and because it's bright sun, we turn our backs to the sun, and then our neck and upper back get burned badly. So if you cannot reach those areas, and you cannot reach those areas, you have to have somebody who likes you a little bit at least, or loves you madly and passionately, to put that sunscreen on you and be generous with it. This is not the time to be lighting. You're not trying to rub it all in. You want to see some visible sunscreen. So not a problem. And then if you spend quality time in the water, you're rinsing off the sunscreen. You need to reapply as soon as you get out of the water. If you've been out in the sun for 4 hours or more, you need to reapply your sunscreen, even if you've just been sunbathing. So very important. Karen, you might get the award for question of the day. That is absolutely amazing. Thank you so much. Great question. Carol Craig, CCC. You have gallstones, but they're not bothering you. Will you still need surgery? No. A lot of people are walking around with gallstones and don't even know it. Sometimes they're found at autopsy. And as long as it's not bothering you, the problem with gallstones is if you get a small gallstone, it can literally get into the tree, the bile ducts, and cause obstruction. And then when the gallbladder contracts, and the gallbladder contracts like a perfume atomizer, it squeezes. When it squeezes, it pushes out bile into your intestines to help digest fat. Well, if you get a tiny stone in there, that can be more of a problem than a large stone. Then you can get a large stone, as long as it's sitting in a spot and not blocking the plumbing outlet, you can walk around with it for the rest of your life. It's not a problem. If it ever gets where it's blocking the plumbing, that's called a ball and valve effect. Then it can block. I mean, you can literally change your position and cause the gallstone to roll away, and then you're fine, and you will get relief from that. I have found that The anti-diarrheal medication Imodium helps with gallstone pain as well. It's one of the things I use to diagnose it. If I have a person that's hurting, I give them that. It relaxes the biliary tree, and will oftentimes give some relief from a gallstone. When that happens, then I know, then I can get x-rays, and there's a diagnostic test called the ERCP, where they literally thread down through your throat into your stomach to get to the biliary tree, which is in the first part of the small intestines. They squirt dye in there and they see if it's blocked or obstructed by a tiny gallstone. A gallstone getting into the biliary tree is called a gallstone ileus. It can be a problem as well. So, but again, if the gallstone's not bothering you, I would wait until it bothers me. Having a gallstone is the condition of cholecystitis. What is it? Cholecystitis is inflammation of cholecystosis. It's condition of you have a gallstone, it's not bothering you, you're not bothering it. As long as you don't eat a lot of high fat foods, it might not ever bother you. The primary treatment when a person develops symptoms is to limit the amount of fat in the diet, so the gallbladder doesn't have to contract to squeeze out bile to digest fat, and then you walk around with it until. But once it flares up, you have cholecystitis. It's like appendicitis, and then it needs to be surgically removed. Once it's flared up, antibiotics alone is not going to probably give you relief. You're going to have it removed. And so fortunately now they can do that oftentimes through your belly button arthroscopically and not give you that disfiguring abdominal scar that used to be indicative of gallbladder surgery. You'd have a diagonal scar on the right side of your body that was impossible to hide and not too attractive. But now, if you're lucky, you get tiny little incisions that you barely can see. And they can go in and remove even large gallstones. They go in there, capture and put them in a little basket, pull it out. It's amazing surgery. But that's minimally invasive treatment of gallstones. So that's one of the things you can do. Okay, great question. Have any suggestions on alopecia treatments? Yes, amazingly enough, Dr. Collier suffered from alopecia, and most commonly caused by stress. It can also be caused by infectious diseases, such as fungal infections. We've all seen dogs and little children with what we call tatter. That's a fungal infection, tinea corporis or tinea capitis on the head that can give you maybe one spot, sometimes more, of a loss of hair. Other times it can be global. You can have alopecia where you're losing all of your hair, sometimes due to an autoimmune disease, but hair loss is thyroid disease until proven otherwise. That's what a wise doctor told me, and I've taken that to the bank. It's thyroid disease until proven otherwise. If you treat the thyroid, the hair will come back. Anemia will be another cause because the hair is very demanding on blood flow. Your scalp is very vascular, and it takes a lot of nutrients and blood to get your hair to grow and to keep the hair healthy. So if something disrupts that, it can be atherosclerotic cardiovascular disease, it can be high cholesterol, it can be a variety of things. You improve the blood flow, which is why you see a lot of these laser therapies that are coming on now. They improve the blood flow. As long as you do not have scarring. Once you have scarring, you have lost the hair follicle and the ability to regrow the hair. If you don't have scarring, you just have loss of hair, that means the hair can regrow. That's why sometimes when people get chemotherapy, they lose their hair, but then after they complete the chemotherapy rounds, the hair will grow back and it grows back fully. So that is the type of things that we can expect there. Sometimes injections of steroids into the scalp, multiple injections can help. Oral steroids can help. It just requires a great partnership with usually a dermatologist who specializes in hair, and if you're Black, African-American hair, and doing so to try to save what hair you have and try to regrow if that's possible. If not, there are other techniques that they can do now. They can do graft, they can do micrografting, they can take hair from here and usually the back of the head and inject it anywhere, and it will grow and be viable hair. So various things that can be done, techniques are there, but it's a process. So decrease the amount of stress in your life, make sure that you are getting enough rest, meaning 8 hours of sleep, hopefully. Take supplements like omega-3 fish oil to maintain good cardiovascular health and decrease the amount of inflammation in your body. That's what vitamin D will do as well. And just maintain a good health status. So there are things that can be done. It is a process. There's no rapid procedure. Nothing I'm going to give you today that's going to grow hair tomorrow. But you work with it for a few months, and oftentimes you can have great results. So find you a good dermatologist that specializes in hair loss. It's kind of a subspecialty of dermatology, and see what they can do to help you. Great question. Janae, okay, I'm having sharp pain under my right breast. What could that mean? Under the right breast, thank goodness it's not your heart, so we can relax from that. But there are other things that it could be, from pulmonary embolism, which would be life-threatening in a major emergency, to strain on the muscles of your chest, where just strain from the muscles, or the weight of your breast could be pulling down, or what's called the costochondral junction, where the pectoral muscles are attached to your ribs. That is called costochondritis. Easy enough to diagnose in the doctor's office. You could find that out by being seen by your primary care doctor. They sometimes may want to do additional testing, but I would try a course of anti-inflammatories to see how that works in doing so. It could also be an indication of anything from gallstones to a hiatal hernia or acid reflux. So a lot of possibilities here. So that needs to be evaluated. But sense of urgency, we're still at DEFCON 5 because it's on the right side and not on the left side. So on the left side, EKG first order of business, but not that. So I think you'll be okay, Janae. Just work with the doctor. Don't hesitate. Next question. Okay, Veronica Wallace. Ain't taking no more. That might be the greatest middle name. I was trying to say I might not be able to pronounce it. And then when I actually read it, I was like, okay, Veronica, you all right with me. Haven't had a period in 4 years. I'm 55. This means I'm going through menopause. Veronica, that means you have gone through menopause because you haven't had a period for 1 year. So at 4 years, I can say unequivocally that you've gone through menopause, but that's just one of the symptoms. The other symptoms could be anything from, again, decreased libido, weight gain, overall change in personality, honoriness, if you will, things that you would greatly benefit from for hormone replacement therapy. And I recommend bioidentical hormone replacement therapy as the option for you. Don't wait until things start happening, like you start losing your hair, or again, you have such a lack of interest in sex, or sex becomes painful because your vagina is thin and dry and difficult to penetrate. So sex is not fun for you. It's not pleasant. So you try to avoid it as much as possible. This makes your partner feel rejected. It causes all kind of interpersonal problems. So get this addressed as quickly as possible. Partner with your primary care doctor that is sensitive to and knows how to treat these symptoms. A lot of doctors don't. Or your GYN, all of which do or should know, and try to find out about bioidentical hormone as an option. Google it, get more information, search for providers that are near you. Just say BHRT near me, and something will pop up, I'm sure, and then we can get to the bottom of this. But the answer to the question is yes, you've gone through menopause. I had a fem pop bypass done, and now neuropathy in my last 4 toes are unbearable. The gabapentin is not working so fast. What do you suggest? It's just 1 foot. Patty, why not? Oh, I'm so sorry to hear that. A fem pop bypass is where you have had obstruction of the blood flow in the arteries to that leg. And the further away you get from the central core of the body, the worse the circulation is. So now that's why you're having the pain in your toes. Gabapentin, Neurontin, is a product that's for neuropathic pain. It helps calm down the nerve signature that does that. Gabapentin works wonderfully for this problem. The thing is, you got to be on a therapeutic dose. It does not ease the pain down, but you have to get it to a level that works for you. And once you're at that level, it literally cuts the pain off like a light switch. It doesn't ease it down, it just stops it. Now, most people start off on as little as 100 milligrams of Neurontin twice a day. I have some patients that are on 600 milligrams 3 or 4 times per day, and even higher doses. So it's the dose that you can tolerate that gives you symptomatic relief. So some doctors are very slow to titrate, and you make that comment. You say it's not working so fast. There's no reason to slow the process down. If you are not getting benefit at a certain level, it takes about 3 days for the medication to come to what's called steady state in your body. Then you can increase the dose. You don't have to wait a month on 1 dose. So that aggressive titration up to a therapeutic dose may give you the relief that you're seeking with this product. Yeah, so neuropathy is a big problem, and fortunately it's in one foot now. The other foot is coming if we don't do something about this. I hope they evaluated the circulation on the other leg too, because it's rare the person just gets spin pop on one side. Most of the time they'll need it on both sides, because cholesterol plaquing, which is the primary problem, is never in one place. If it's in one place, it's every place. And again, so you need to also evaluate your cardiac vasculature to make sure you don't have any blockages in your heart, because if you got blockages in your big vessels, your small vessels ought to really be compromised. Great question, Patty. Why not? We appreciate that. Monica Allen, what I suggest for plantar fasciitis. Plantar fasciitis is where the bottom of your foot is very tender, sore, or painful. It can be associated with a heel spur or not. There's a tissue that's under your skin that's kind of like saran wrap called fascia. Plantar means on the bottom of the foot. So the plantar fascia is normally there to provide some support to the tendons on the bottom of your feet, so that when you curl your toes like that, those 5 tendons don't get too much stress on them, and they won't tear or break. So they have to support your body's weight and protect themselves. Well, itis means inflammation of. Sometimes you can get inflammation in them, particularly if you don't have good arches or good arch support in your feet. So minimal therapy would be massages. Some people do it with heat. Some people do it with ice. They'll put ice in a tube and roll, and you can just literally put your foot on top of it and roll it. You can do it with a tennis ball or a hard rubber ball. There are inserts that will go in your shoes that can do that as well. For more severe cases, you sometimes have to go in and cut and release the plantar fascia so it's not under stress, and that gives relief over time. Other treatments include injections with steroids into the plantar fascia to give you some relief. But you need to get to know your friendly neighborhood podiatrist. They are the best specialists to treat plantar fasciitis, and I think that very few people ultimately have to have surgery, but some do, and you may be one of them. But I would try conservative therapy first, wearing flat shoes versus heels. Again, the massages, the foot massages, and heat or ice, depending upon which one gives you the most release. Anti-inflammatories such as Motrin, Advil, or Aleve, and then the shoe inserts. And most stores now have what are called the Dr. Scholl's thing, where you put your foot into a styrofoam mold, and it takes an impression and then recommends certain inserts for you, which is the same thing the doctor does, but he'll have them custom made. So depending upon your degree of pain, discomfort, you can either try something like that. But if you haven't tried those, or if you have tried them and haven't gotten relief, go to a podiatrist who is a doctor that specializes in diseases of the feet. Really, they do the legs from the waist down, the hips down, but more commonly, you're more familiar with them dealing with foot problems. So great question, Monica. Okay. I've increased my protein intake via boiled eggs and protein shakes, but now it seems like I'm gaining weight and not losing. What am I doing wrong? Total caloric intake, including protein. Protein needs to be about 30 grams at each meal. And then it needs to be at least a third of your total dietary intake throughout the day. But you can't eat 5,000 calories. So you need to make sure that the amount of calories that you're taking in for weight loss for a woman, 2,000 calories or less, between 1,600 and 2,000. For a man, between 2,000 and 2,500 for weight loss. To lose 1 pound, you have to decrease your caloric intake by 3,500 calories. That's 500 calories a day times 7 days is 3,500. By doing so, by just decreasing your calorie intake by 500 calories, you can drop 1 pound a week, 5 pounds a month. That's absolutely free information. Doesn't cost you anything from Dr. Collier. The math is easy and simple. But if you're taking in more than that and you're not burning calories, then you need something to help you metabolize your fats in particular and burn those calories. That is what the Lipodrops Max formulation is for. The Keto Max as well. All things that can help alter your body's metabolism and help you more effectively and efficiently metabolize your food, so you can get all the good stuff out of it, but you're not storing food as fat and increasing your weight. And that's what we're trying to do now. Okay. Chili Wheel, I like that. Can you explain what Plaxivir does for COVID-19? I took it like 2 weeks ago. Okay, Plaxivir has 2 medications in it, actually. And what they do is they stop the replication of the virus Part of it stops the virus from being able to enter the cells and take over the mechanism of your own cells to make more virus. That is the way virus works. The other stops the replication of the virus once they are already been made and released. So that combination of two things will decrease not just that virus, but other viral illnesses such as HIV. This technology was developed to treat and control HIV. And you hear cases now of people, quote, living with HIV. Because they can control the viral load, they can decrease the virus to such a low number that it's undetectable, which is like not having HIV, and you can't spread HIV when you're doing them. Doesn't cure it, but controls it. And so Paxlovid works on the coronavirus in a similar fashion by decreasing your body's ability to replicate. But again, what I talked about at the beginning of the show was that there are cases now where you shut down that mechanism, but 5 days may not be long enough, and a week later or 2 weeks later, you're having a recurrence with much more enthusiasm. Not only does it come back, it comes back worse, stronger, harder. So they may look at this and say you need more than 5 days of the Paxlovid, and doing so, all other drugs like it. There are 3 oral treatments for COVID on the market right now. Paxlovid is the Pfizer product, and it's out there and available. Others are not readily available yet, but they will be in the next month or so. So great question, Chili Will. We appreciate that. Paula Parks Nance, what I think about cryotherapy? Well, Paula, it depends on what we're cryotherapying. That basically is where you use liquid nitrogen, extreme cold to destroy tissue, shrink tissue. It can be used on everything from cancers to removing moles and warts. So it just depends. But decreasing tumor burden is what I'm feeling is the spirit of your question. Is very good for that, particularly breast lesions, for men, prostate lesions. Cryotherapy is a good, viable option. The thing about cryotherapy is that it's difficult to control the zone of therapy. And we're talking about millimeters here. So you have to basically control how long you're exposing the tissue to the decreased temperature, because it's going to kill the tissue, and you only want to kill the bad stuff. And if you leave it on too long, or the zone, it starts in the center and grows out. You don't want to go beyond that and start to destroy normal tissue and viable tissue. So it kills the tissue, hopefully most of the bad stuff. That tissue has to slough or die off or rot off, whatever term you want to use. And so that process is one where your body normally will clean this up. Your white blood cell counts will take away the dead tissue, eat it up, remove it, and all is well. Sometimes you got a load of dead tissue in some areas that are not being removed easily because blood flow to that area is compromised. And so that can create a problem in and to itself, because you have the dead tissue that is literally rotting in those areas. So cryotherapy, again, if you're using it topically, superficially, zap a wart, a mole, those things are easy. You just zap it, you remove it, is good. But if you're doing something internal, then it is much, the skill of the surgeon that's doing it, very important. You want to make sure that you're not the first person they've done this technique on, that this person is well experienced at using cryotherapy. It's very effective, but again, it's directly proportional to the skill of the person that's doing it to you. Okay, great question. And Kennedy, does having low white blood cells and high red blood cells have anything to do with hair breakage? Low white blood cell, or it's called leukopenia. White blood cells are your soldiers that are fighting infection in your body. Sometimes you have low white blood cells because your bone marrow is not making enough of them. Other times you have chronic inflammation and infection, and your armor is being decimated because your white blood cells are fighting infection as soon as they are developed. And they also have to go through a mature phasing. So you have young white blood cells, they have to go through medium stage, and then they have to get to their most effective adult stage. And at that point, they're fighting infection. But oftentimes when they fight the infection, it's suicide. They have to basically capture the bacteria, virus, or whatever, explode, give acid, dump acid on it, whatever thematically you want to visualize. But when that happens, the white blood cell destroys itself as well. And so if it's constantly fighting infection, you have a low white blood cell count. A high red blood cell count means and probably is related to your bone marrow trying to kick out both red and white blood cells to maintain a homeostatic condition for you. So when you have high red blood cells, this needs to be evaluated. Whether it has anything to do with the hair breakage, it may be a symptom of something. The hair breakage itself is a symptom of probably baseline inflammation. And the question is, what is it, inflammation or infection is your body fighting? So this would be, again, you want to get that vitamin D level up. The normal range is 30 to 90. You want to get it between 60 and 90. So your immune system is optimized and you're getting great benefit from your body's own natural defenses to try to fight this. So a course of antibiotics might not be a bad idea as well, but this is something that needs to be evaluated. Possibly you're going to have two people on your team, the dermatologist as well as a hematologist / oncologist. Don't be afraid of that. Hematologists are blood specialists. They oftentimes are also oncologists, which are cancer specialists. I have referred people to a hematologist for evaluation of their blood, and they get to the door and they say, oh my God, I got cancer. Dr. Collier sent me to a cancer specialist. No, that's not why I sent you. I sent you for the hematology only, but they have hematologists / oncologists as far as the treatment is concerned. Okay, let's get a little water. Okay, last question. I'm diabetic, losing weight in my legs, skinny. How can I gain the tone in my legs? Mrs. Paris. Okay, exercising, walking, leg lifts, walking on your, just you can just stand up on your toes and just kind of go up and down legs. I do that while I'm brushing my teeth to keep my calves healthy and toned. I'm a tennis player, and that helps tremendously. And it also gives you nice formed calf muscles with great definition that are aesthetically appealing as well. So you can do that. It's rare that weight loss is targeted or focused. So if you're losing weight in your legs, that means the only place you have fat. So because normally you lose fat from 1,000 other places, like the hips and the abdomen, before you lost it in your legs. But and I'm not sure that diabetes has anything to do with this. But when your diabetes is uncontrolled, one of the symptoms is weight loss. So I've had people who've not been diagnosed with diabetes. They have a major weight loss and they are afraid that they have HIV or cancer and scared to go to the doctor. And when they go to the doctor, I say, oh no, your blood sugar is 600. You have diabetes, and that's why you've lost the weight. And it's like a sense of relief. Oh, it's just diabetes. Well, now we got to deal with the diabetes. So make sure that your blood sugar is well controlled. Your diabetes is being treated optimally. And then your weight will stabilize, and you can start to do that. But the calf muscles and your legs are muscles. You can do squats for your upper legs. You can do the toe stands for your calves and your lower legs, and we'll get that definition that looks good during Beachbody season. We're gonna get your Beachbody, Miss Paris. All right, that was the last question. Thank you so much, Heilig, for all you do. Heilig is behind the scene producer. He gets your questions up. He gets the scrolling across the bottom. Remember, for more information and to access any of the products that we've spoken about, go to lipodrops.com and order your Dr. Collier's Trio. That's the probiotics, the vitamin D, and the omega-3 fish oil. Add the Lipo Immune to your system because things are going on. This the cases of corona are increasing. People are still experiencing everything from allergies to sinus infections and things like that. So boost your immune system optimally with our Lipo Immune product. And again, lose the muffin top with Lipodrops. Get on board. Dr. Collier is losing. He's using the Lipodrops Max. He's using the Keto Max. He is now 32 pounds down, going for 40. Let me get this straight. Going for 40. And we are going to really celebrate. When I get to that 40 pounds down, we're going to really celebrate. Didn't take the plunge like I planned on this week. I was going to go buy some more clothes. Just never got to it because of Mother's Day this weekend. I'm going shopping again. And so you'll get to see some of the smaller clothes that Dr. Collier's had to buy because this collar, I can get my whole hand in there. It's too loose. The shirt, I got my tie tightened up just so my shirt isn't gapping open. The shirt is billowing and my pants, the waist size, I can put my whole hand in there. Extra space. This is a good situation to be in. I appreciate it. And thank you for tuning in to the Your Health is Important Facebook Live broadcast. We'll see you